those are and of course this is not a permanent solution. This is only because still there is a political campus of them will not come up. So we thought we will help them temporarily and then we can get trained. We start the whole program. People will come to know. By the time you move, then the patient's flow will become more. Right now they are also doing house to house, which is home care is going on. So when the home care goes on, if some patient is there, then there is the requirement for a ward will come. That is how we have given a small ward. Right. Thank you.
Thank you very much.
Dr. Gangadhar Sumayanshi, Registrar, YENEPOYA University, CA English, past District Governor, Lions Club.
Deserves to be embraced with dignity, comfort and compassion. Thus, when two words, palliative care, comes to fore. Ladies and gentlemen, esteemed guests, members of our supportive media and cherished well-wishers, today marks a momentous occasion as we gather to inaugurate our newest endeavor. Palliative care ward in this YENEPOYA hospital in NARINGANA. It's my urgent duty to express my gratitude to the management of YENEPOYA University and group of institutions who have strongly backed all our initiatives since 2019 when we took off. While the Tapasya Foundation's infrastructure is getting ready at Modipo, it's YENEPOYA University which is providing us the needed resources and infrastructure to carry out our activities indulging in the palliative care wards. We are indeed indebted to YENEPOYA institutions who are providing us all requisites facilities including provision of free medicines for the palliative care center here today. In a world where the pursuit of cure often overshadows the pursuit of comfort, establishing a palliative care center is not just a necessity but a moral imperative. It's our duty to ensure that every individual, regardless of their condition, receives the holistic support and relief they deserve in their journey towards the end of life. So the Tapasya Foundation and Lions International District 317B has taken the onus to handle this moral obligation. It's my pleasure and privilege to welcome the August gathering to this meaningful ceremony. When we think of palliative care, the closest word that comes to mind is the dreaded cancer. A surgical oncologist is someone who has seen the extremities of life and death from close quarters. And if it's someone from this fraternity who has been with foreign together with us, he surely is the apt person to be inaugurating this noble endeavor. Amidst us our guide who never hesitates to render his advice, advises with utmost practicality and guides us forward. A doyen in the field of surgical oncology, an administrator par excellence and Tapasya Foundation's guiding light, Vice Chancellor of YENEPOYA University, Dr. M. Vijay Kumar, is here to inaugurate the palliative care ward here today. A heartfelt welcome to you, sir. There is no much formality needed as you are our Orion Appreciative. Himself is an inspiration to all of us, a person who has climbed up the ladder of success from humble beginnings to establish routine of financial despite his pressing engagements, being with us today shows his commitment to our cause. A very warm welcome to you, sir. Tapasya and Lions have walked hand in hand in giving shape to our project of establishing the Palliative Care Center for Terminally Ill and Pediatric Oncology Center at Pudipur. Our Lion leaders have shown their strong support year after year. This term stands District Governor, our international District Governor Vasan Shetty has always been enthusiastic in being with us on all occasions. I take this opportunity to recognize with gratitude his efforts to support our foundation in realizing our dream project. Hearty welcome to you, sir. Or the mega events like the Tapasya Foundation's Mangaluru Triathlon and this year's Beach Festival, media has played a key role in bringing visibility and thus public support in making our event successful. A heartfelt welcome to all media personnel as we hope to seek your continued support in the time to come. A very warm welcome to all our well-wishers who are here to take our journey forward. Together we stand committed to providing comfort, dignity and solace to the individuals and families facing life's most challenging moments. The palliative care ward here will rightfully serve its purpose. Welcome one and all. Thank you.
To address the gathering.
My precious brother gathered here. I am grateful for inviting me as guest here today, and I am already a part of the foundation. We had the program to raise funds, and the construction work is going on, and I hope this will help them to get the expertise with the palliative care unit, which is going to be here for some time until the project is totally completed and we can shift it there. Until that time we have a mobile facility also, as well as this palliative care will give a kind of how they have to operate with full-fledged property. So we are thankful to NARINGANA Institute to providing this place, and I feel that it will help the people around who are suffering from this, cardiac diseases. They can take a kind of advantage of this, and feel Tapasya will give a good service to those people who are really need this kind of facility. So I wish all the best for the initiative, and I thank NARINGANA for giving this opportunity for the foundation. Thank you very much.
Sabita Shetty, inaugurator, Dr. Ajay Kumar sir, Vice Chancellor, Dr. Sripati sir, NB Shetty sir, Principal of Palliative College, and all the invited guest students. ಮೊದಲಿಗೆ I thank YENEPOYA Guru for this fantastic support to Tapasya Foundation. Sir Vijay Kumar sir, Vice Chancellor ಅವರು ಒಂದು ವರ್ಷದ ಹಿಂದೆ when we started the Tapasya Foundation work, ಅವಾಗ ಮೊದಲಿಗೆ ಮುಂದೆ ನಿಂತು ಈ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಸಹಕಾರ ನೀಡಿದವರು is the first donor Tapasya Foundation ಕೆಲಸ ಸ್ಟಾರ್ಟ್ ಆಗಲಿಕ್ಕೆ ಫಸ್ಟ್ ಡೊನೇಷನ್ ಕೊಟ್ಟದ್ದು ಸರ್ ವಿಜಯ್ ಕುಮಾರ್ ಸರ್. ಅವತ್ತಿಂದ ಇವತ್ತಿನವರೆಗೆ ಸುಮಾರು 2 ವರ್ಷದಲ್ಲಿ ತಪಸ್ಯದ ಕೆಲಸ ಪ್ರಾರಂಭ ಆಗಿದೆ. ಇಲ್ಲಿ ಹತ್ತಿರದ ಉಡುಪಿನಲ್ಲಿ ತಪಸ್ಯ ಫೌಂಡೇಶನ್ ನೇತೃತ್ವದಲ್ಲಿ ಪ್ಯಾಲಿಯೇಟಿವ್ ಕೇರ್ ಸೆಂಟರ್ ಕೆಲಸ ಈಗ 2ನೇ ಫ್ಲೋರ್ವರೆಗೆ ಕನ್ಸ್ಟ್ರಕ್ಷನ್ ಆಗಿದೆ. ಅದರಲ್ಲಿ ಲಯನ್ಸ್ ಕ್ಲಬ್ ಇಂಟರ್ನ್ಯಾಷನಲ್ ಫೌಂಡೇಶನ್ ಮೂಲಕ ಸುಮಾರು 1,40,00,000 ರೂಪಾಯಿ ಪೀಡಿಯಾಟ್ರಿಕ್ ಕ್ಯಾನ್ಸರ್ ಕೇರ್ ಸೆಂಟರ್ಗೆ ಬಂದಿದೆ. ಆ ಹಣದ ಮೂಲಕ ಈಗಾಗಲೇ 1 ಫ್ಲೋರ್ನ ಕೆಲಸ ಮುಗಿದು ಅದರ ಎಲೆಕ್ಟ್ರಿಫಿಕೇಶನ್ ಮತ್ತು ಪ್ಲಂಬಿಂಗ್ ಕೆಲಸ ನಡೀತಾ ಇದೆ. ಮೀನ್ವೈಲ್ ಆ ಸೆಂಟರ್ ಆಗುವವರೆಗೆ ಟೆಂಪರರಿ ಅಂತ ನಾನು ಹೇಳಿ ಹೋಗುದಿಲ್ಲ, ಮೀನ್ಸ್ 1-2 ವರ್ಷಗಳವರೆಗೆ YENEPOYA ಈ ಕೊಡುಗೆ ಆ ಪ್ಯಾಲಿಯೇಟಿವ್ ಕೇರ್ ಸೆಂಟರ್ ರೆಡಿ ಆಗುವವರೆಗೆ ತಮ್ಮ ಕಟ್ಟಡದಲ್ಲಿ ಈ ಸೆಂಟರ್ ಅನ್ನು ನಡೆಸಲಿಕ್ಕೆ ಅವಕಾಶ ಮಾಡಿಕೊಟ್ಟಂತ YENEPOYA ಗ್ರೂಪಿನ ಮತ್ತೆ YENEPOYA ಇನ್ಸ್ಟಿಟ್ಯೂಷನ್ ಎಲ್ಲರಿಗೂ ನಾನು ತಪಸ್ಸೆ ಮತ್ತು ನ್ಯಾಷನಲ್ ಇಂಟರ್ನ್ಯಾಷನಲ್ ಪರವಾಗಿ ಆಭಾರಿಯಾಗಿದ್ದೇವೆ ಅಂತ ನಾನು ಹೇಳಿದ್ದೆ. ದಿಸ್ ಇಸ್ ಎ ಗ್ರೇಟ್, ಇದರಲ್ಲಿ ಲಾಭದ ವಿಷಯ ಇಲ್ಲ, ಇಟ್ಸ್ ಎ ಸರ್ವಿಸ್. ಒಂದು ಎಂಡ್ ಸ್ಟೇಜ್ ಕ್ಯಾನ್ಸರ್ ಪೇಷಂಟ್ಗೆ ಅಗತ್ಯದ ಸರ್ವಿಸ್ ಕೊಡುವಂಥ ಅಂತಃಕರಣದ ಕೆಲಸ YENEPOYA ಸಮೂಹದ ಮೂಲಕ ಆಗಿದೆ ಸರ್. ವಿಜಯ್ ಕುಮಾರ್ ಸರ್, ನಿಮಗೂ ಮತ್ತೆ ಈ ತಂಡದ ಎಲ್ಲ ವೈದ್ಯಾಧಿಕಾರಿಗಳಿಗೆ ಹಾಗೆ YENEPOYA ಗ್ರೂಪಿನ ಎಲ್ಲ ನಿರ್ದೇಶಕರಿಗೆ ನಾನು ಲಯನ್ಸ್ ಕ್ಲಬ್ ಇಂಟರ್ನ್ಯಾಷನಲ್ ಪರವಾಗಿ ಹಾರ್ದಿಕವಾದ ಅಭಿನಂದನೆ ಮತ್ತು ಅಭಿನಂದನೆ ಸಲ್ಲಿಸಲಿಕ್ಕೆ ಬಯಸ್ತೇನೆ. ಹಾಗೆ ನನ್ನ ರಿವ್ಯೂಸ್ ತಪಸ್ಸೆ ಫೌಂಡೇಶನ್ ಚೇರ್ಮನ್ ಮತ್ತು ಟ್ರಸ್ಟಿಗಳಲ್ಲಿ ಏನು ನಾವು ಕೆಲಸ ಪ್ರಾರಂಭ ಮಾಡಿದ್ದೇವೆ ಅದನ್ನು ಆದಷ್ಟು ಬೇಗ ಮುಗಿಸಿ ಅಟ್ಲೀಸ್ಟ್ ಪೆಡಿಯಾಟ್ರಿಕ್ ಕ್ಯಾನ್ಸರ್ ಕೇರ್ ಸೆಂಟರ್ ಅನ್ನ ಸಮಾಜಕ್ಕೆ ಅಟ್ಲೀಸ್ಟ್ ಒಂದು 6-7 ತಿಂಗಳಲ್ಲಿ ಅರ್ಪಿಸುವಂತ ಬದ್ಧತೆಯೊಂದಿಗೆ ನಾವು ಕೆಲಸ ಮಾಡಿದ್ರೆ ಆಗ ಪ್ಯಾಲಿಯೇಟಿವ್ ಕೇರ್ ಸೆಂಟರ್ಗೂ ನಾವು ಹಣವನ್ನು ಫೌಂಡೇಶನ್ ಮೂಲಕ ತರಿಸಲಿಕ್ಕೆ ಸಾಧ್ಯ. ನಿಟ್ಟಿನಲ್ಲಿ ನಾವೆಲ್ಲ ಸೇರಿ ಕೆಲಸ ಮಾಡುವಂತ ಹೇಳ್ತಾ ಇವತ್ತಿನ ಈ ಪ್ಯಾಲಿಯೇಟಿವ್ ಕೇರ್ ಸೆಂಟರ್ YENEPOYA ಆಯುರ್ವೇದಿಕ್ ಕಾಲೇಜಿನಲ್ಲಿ ಪ್ರಾರಂಭ ಆಗಿದೆ. ಅಗತ್ಯ ಇರುವವರಿಗೆ ಅತ್ಯಂತ ಸೂಕ್ತ ಸೇವೆ ಸಿಗುವಂತಾಗಲಿ ಅಂತ ಹಾರೈಸಿ ನನ್ನ ಮಾತನ್ನು ಮುಗಿಸ್ತೇನೆ. ಜೈ ಹಿಂದ್.
Our university who have assembled, for everybody a very very warm welcome from my side. Everybody is talking about palliative care ward, but I thought 2 minutes I'll take to say what is palliation, because many of you may or may not know, and why there must be a ward for that separately, and why that ward Tapasya Foundation should have it in our university. So I thought I'll just touch upon this in a few minutes, just for the sake of knowledge and information. Palliation by definition is just symptom relief, we can tell. In a simple English, palliation means symptom relief. For example, you have an headache, you give a painkiller and the headache goes. Without even taking care of the root cause, we can just call it as palliation, because we are just removing the symptoms. And the same thing we cannot do in cancer in the early stages. I'm coming from cancer background, so I know the importance of palliation. So with respect to the cancer treatment, the palliation by definition WHO goes like this. That is, to treat the symptoms, to prevent the symptoms, to treat the complications, and to prevent the complications of cancer without changing the natural history of the disease. It's a very elaborate one. In a simple English, if I have to tell, we will be able to take care of the palliation means the symptoms which are caused by the cancer or the complications, but not the cure. So that is the stage where the palliative people come into the picture. Surgical oncology or surgery, radiotherapy, chemotherapy, systemic therapy, immunotherapy, all are used when they are actively treating the patient for cancer with an attempt to cure or prolongation of survival. When the palliative treatment also is not possible, that is, if you have a bone metastasis somewhere, we will give radiotherapy to reduce the bone pain by giving active anti-cancer treatment. Even that is not possible, that is where the palliative care begins. Meaning, no anti-cancer treatment will be available or possible or not feasible, and it is not useful. In such situations, only we are taking care of the symptoms. It may be in the form of pain, it may be in the form of vomiting, obstruction, whatever it is. Only the symptom relief is given, it is called as palliation. When I say this, you will be understanding a bit at least. That means we have already spent out all the formal modalities of treatment, and we are calling it probably a day, meaning they are nearing the end of their life. So the end of life is what is called, we call it as terminally ill. In the terminally ill patients, we are expecting them to die in simple English. But from the time when we have stopped their very active anti-cancer treatment till death, to go through that is the phase which nobody wants to take care of. Neither the people, neither the friends or the family, because they cannot go through it. Not because it's costly, but they cannot go through that emotionally speaking. So that is where the importance of palliative care wards and terminal ill care hospitals coming. They are called as hospice. HOSPIC. The hospice is the concept where we are keeping them to have a good quality of life, to have them to see that they die with dignity. To die with dignity is the motto of the palliative care, and not to treat for the cure is an aim. Why I am saying this very clearly is, we are going to see more deaths in these wards. It is bound to happen. That is what these beds are meant for. And that is going to happen means many of the other patients who are around us may not like it, and that is why most of the hospitals do not have this terminal ill care ward, because it will be emotionally draining other patients, other family members, etc. So they always keep this terminal ill care hospitals little away and out of the regular hospital services. But having said that, it is very, very difficult to run. This is what I was telling them. It is going to be a challenge. But Dr. Mrs. Savita Shetty and their colleagues said, we will take up the challenge. I said, yes, I am not only talking theory, take my 1 lakh with you and try to start. That's what I said, literally challenging them that it is going to be a big problem as you go on emotionally. Nothing to do with physical, because it is draining to treat every day a patient who is not well, but we cannot help him to cure. That is the challenge we are going to face. And added to that, these people are starting with pediatric oncology. Pediatric, people should be knowing, children. They are going to take care of the children who are going to be terminally ill, who cannot be cured. It is much, much more emotionally draining for anybody who is involved with that. It can be just a bystander, it can be a nurse, it can be a doctor, it can be anybody, whoever it is, seeing the kid dying right in front of us and standing helpless as a new spectator is the one which is going to happen, and that is going to be the big challenge. The next challenge in anything, in all these things when we are talking about, is the fund mobilization. Because in the beginning, nobody is going to give the fund. We will have to show them what we are working. Then only probably the fund will come much more easily. I was involved in Bangalore for the Karunashriya, which is also an NGO with Dr. Rao. They would manage to get 5 acres of land. I still remember that is 30 years ago when I was young. That from government of Karnataka in Whitefield area, and that they started. In the beginning, I know how much they struggled. For almost 10 years they struggled. Today they are relaxed, relieved, because a lot of funding and the resources is actually pouring in. But till that 10 years there, it may be 10 years here, maybe more or less, I do not know, to stand that problem of going through that problem with the fund mobilization, with the patients, students, relatives and the nursing staff. Having said that, the third challenge is going to be human resources. You have enough and more of nursing students coming out of this country. I don't know how many of you know, 50% of the nursing colleges are in Karnataka. But to get them appointed in a palliative care setting is going to be another challenge, because it will be emotionally draining. The nurse will run away in a month or so. She is ready to work, but she cannot go through that emotional turbulence. That is going to be another challenge, and these are some of the challenges which they have to go through. But with all these difficulties, when Sudhamarai met me in the UK first time, he said it, I said, Bangalore, let's see what we can do. And then I came and told my Chancellor and Pro-Chancellor, they are very much happy to support them, and I am thankful to the management, particularly Mr. YENEPOYA, who went 1 yard away or more by not only supporting them, saying that, sir, you go ahead and give them. And I contacted our principal, the principal was ready to give us a 10-bedded ward, which may look very small for people who are seeing it. But to maintain that ward, unlike the other hospital ward, is going to be the challenge, is what I am talking. People will not be there. You will appoint somebody, within 15 days they'll run away. You will appoint another person. So what will happen in the night when there is no night duty? What will happen? There is going to be a death in the night, who we are going to call. These are some of the challenges which we will have to go through. We will support them from medically speaking, me and administratively Mr. YENEPOYA. No doubt, we will support. When we give the word, we are going to support. But these are the bigger challenges which they have to follow, whether they are here or going to put it. So it is better they pilot it with us. That's what I thought as a professional. Let them pilot with us so that we can at least support them medically and otherwise in the beginning, so that they learn. The people, Tapasya Foundation members will learn that from us in this area, what are the problems which they are going to face. So they will be getting ready when they move to the Mudipu campus of their own, and then it will be a bigger issue. It will not be a bigger issue, it will be a smaller issue, because they will learn from us what to do, what not to do. Having said that, we are not only supporting them, just giving a place here with water, electricity and etc. We are supporting them with drugs. We are giving them pain relief measures and other drugs required free of cost, and I am very thankful to the Pro-Chancellor, Mr. YENEPOYA, who went all the way and said, we will support them as long as they are with us. That's a very, very big thing which he has taken, because it's not going to be easy to give support to somebody totally free of cost. These patients are not going to pay even if you ask. And you will not have the heart to ask, because they are dying patients. So we have to support them, and we will continue to support them. As long as you are with us, we will continue to support with not only the physical infrastructure, but we will also give them the drugs. And the third most important thing they have done now is the home care. They spoke about it, but I don't think you people would have understood what is home care. Home care is where you have the palliative care patient, but they are not ambulant, and they need not be hospitalized. They can be taken care of by their own family members. But the medical and paramedical care, nursing and other drug care can be given at their doorsteps. They need not come to the hospital for that. The painkiller can be delivered there, the small dressing can be done there, but they are not that ill to be hospitalized. Such service is called as home care delivery, and they already started that. And again, for that we are supporting them with all the dressing material, drugs, etc. And they already appointed the nursing staff. And I am very, very happy to inform you, we are also sharing our human resources in the form of our palliative care specialist, Prajnakini. So she is there as a youngster, we may see, but she is specially trained in Inauguration Cancer Institute. When I was there as the fellowship, and she is readily helping them at this point of time to support them from the medical point of view, so that they will get all the support from us, but it is up to them and the Lions International 370B to take it to the next level. And I only hope that happens much more faster and much more effectively. With these words, I thank them for inviting me to be a part of this program, and wish them all the best. God bless.
With us today. I request all to rise for the national anthem.
ಇದು ಒಂದು 2019ರಲ್ಲಿ ಪ್ಯಾಲಿಯೇಟಿವ್ ಕ್ಯಾನ್ಸರ್ ಕೇರ್ ಸೆಂಟರ್ ಅನ್ನು ಪ್ರಾರಂಭಿಸಬೇಕೆಂಬ ಉದ್ದೇಶಕ್ಕೆ ಪ್ರಾರಂಭವಾದಂಥ ಒಂದು ಸಂಸ್ಥೆ. ನಮ್ಮ ಲಯನ್ಸಿನ ಸದಸ್ಯರಾದಂಥ ಸಬಿತಾ ಮತ್ತು ಎಲ್ಲ ಟ್ರಸ್ಟಿಗಳು, ಟ್ರಸ್ಟಿಗಳು ಸೇರಿ ಈ ಫೌಂಡೇಶನನ್ನು ಪ್ರಾರಂಭ ಮಾಡಿದ್ರು. ಟ್ರಸ್ಟಿನ ಉದ್ದೇಶ ಏನಂತ ಹೇಳಿದರೆ, ಕ್ಯಾನ್ಸರ್ನ ಎಂಡ್ ಸ್ಟೇಜ್ ಕ್ಯಾನ್ಸರ್ನಲ್ಲಿರುವಂಥ ಪೇಷಂಟ್ಗಳಿಗೆ ಕೇರನ್ನು ಕೊಡುವಂಥದ್ದು. ಯಾಕೆಂದರೆ ಮನೆಯವರಿಗೆ ಅವರ ಆರೈಕೆಯನ್ನು ಮಾಡಿ ಕೊನೆ ಹಂತದಲ್ಲಿ ಬಂದಾಗ ಸಾಕಾಗುವಂಥ ಪರಿಸ್ಥಿತಿಯಲ್ಲಿದ್ದಾಗ ಅಂಥ ಪೇಷಂಟ್ಗಳನ್ನು ಗುರುತಿಸಿ ಅವರಿಗೊಂದು ಸ್ವಾಂತನ ಮತ್ತು ಕೇರ್ ಎರಡನ್ನು ಕೊಡುವಂಥದ್ದು ಮಾಡಬೇಕನ್ನೋ ಉದ್ದೇಶಕ್ಕೆ ತಪಸ್ಯ ಪ್ರಾರಂಭವಾದದ್ದು. ಆ ಹಂತದಲ್ಲಿ ಅವರು ಒಂದು ಮುಡಿಪಿನ ಹತ್ತಿರ ಒಂದು ಜಾಗವನ್ನು ತೆಗೆದುಕೊಂಡು ಅದನ್ನು ಸಮತಟ್ಟು ಮಾಡಿ ಕೆಲಸ ಪ್ರಾರಂಭ ಮಾಡಿದರು. ಆದರೆ ಮಧ್ಯದಲ್ಲಿ ಕೋವಿಡ್ ಬಂದದರಿಂದಾಗಿ ಸ್ವಲ್ಪ ಕೆಲಸಕ್ಕೆ ತೊಂದರೆಗಳಾಗಿ ಕೆಲಸ ಸ್ವಲ್ಪ ಸ್ಲೋ ಆಗಿ ಆಗ್ತಾಯಿತ್ತು. ಆದರೂ ಸಹ ಅವರ ಬೇರೆ ಬೇರೆ ರೀತಿಯ ಪ್ರಯತ್ನಗಳನ್ನು KMCಯಲ್ಲಿ, YENEPOYAದಲ್ಲಿ, ಚಿಲ್ಡ್ರನ್ ವಾರ್ಡ್ಗಳಲ್ಲಿ ಮಕ್ಕಳಿಗೆ ಕೇರನ್ನು ಕೊಡುವಂಥ ಕೆಲಸವನ್ನು ತಪಸ್ಯ ಫೌಂಡೇಶನ್ ನಿರಂತರವಾಗಿ 2019ರಿಂದ ಇವತ್ತಿನವರೆಗೂ ಮಾಡ್ತಾ ಬರ್ತಾ ಇದೆ. ಉಡುಪಿನಲ್ಲಿ ಕೆಲಸ ಪ್ರಾರಂಭ ಆದಾಗ ಲಯನ್ಸ್ ಕ್ಲಬ್ ಫೌಂಡೇಶನ್ನ ಮೂಲಕ ಸುಮಾರು 1,40,40,00,000 ರೂಪಾಯಿಯನ್ನು ಅನುದಾನ ಬಿಡುಗಡೆಯಾಗಿದೆ. ಆದರೆ ಅಲ್ಲಿ ಸಹ ಒಂದು ಸಮಸ್ಯೆ ಏನಂತ ಹೇಳಿದರೆ, ಒಂದು ಕೋವಿಡ್, ಇನ್ನೊಂದು FCRA ಸಮಸ್ಯೆಯಿಂದಾಗಿ 2 ವರ್ಷದವರೆಗೆ ನಮಗೆ ಹಣವನ್ನು ತರಲಿಕ್ಕಾಗಲಿಲ್ಲ. ಹಾಗಾಗಿ ಸ್ವಲ್ಪ ಕೆಲಸ ಸ್ಲೋ ಆಗಿದೆ. ಆದರೆ ಒಂದು 6-7 ತಿಂಗಳ ಹಿಂದೆ ಆ ಹಣ ನಮ್ಮ ತಪಸ್ಯದ ಅಕೌಂಟಿಗೆ ಬಂದಿದೆ. ಮತ್ತು ಈಗ ಮುಡಿಪು ಸೆಂಟರ್ನಲ್ಲಿ ಚೈಲ್ಡ್ಹುಡ್ ಕ್ಯಾನ್ಸರ್, ಪೆಡಿಯಾಟ್ರಿಕ್ ಕ್ಯಾನ್ಸರ್ ಕೇರ್ನ, ಮಕ್ಕಳ ಕ್ಯಾನ್ಸರ್ನ ಬಗ್ಗೆ ಆರೈಕೆಯ ಸೆಂಟರ್ ಆಲ್ಮೋಸ್ಟು ಒಂದು ಫ್ಲೋರ್ ರೆಡಿಯಾಗಿದೆ. ಈಗ ಅದರ ಎಲೆಕ್ಟ್ರಿಕಲ್ ಮತ್ತು ಪ್ಲಂಬಿಂಗ್ ಕೆಲಸ ನಡೀತಾ ಇದೆ. ನಮ್ಮ ತಪಸ್ಸೆ ಮತ್ತು ಲಯನ್ಸ್ ಫೌಂಡೇಶನ್ನ ಆಶಯ ಏನಂತ ಹೇಳಿದರೆ, ಒಂದು 6 ತಿಂಗಳಲ್ಲಿ ಆ ಸೆಂಟರನ್ನು ಸಮಾಜಕ್ಕೆ ಅರ್ಪಿಸಬೇಕು. ಅದರ ಮೂಲಕ ಪೆಡಿಯಾಟ್ರಿಕ್ ಕ್ಯಾನ್ಸರ್ ಕೇರ್ ಸೆಂಟರ್ ಬಹುಶಃ ಈ ದಕ್ಷಿಣ ಕನ್ನಡದಲ್ಲಿ ಇದು ಮೊದಲನೇ ಒಂದು ಸೆಂಟರ್ ಆಗ್ಬೋದು ಅನ್ನುವ ನಮ್ಮ ಅನಿಸಿಕೆ. ಆ ನಿಟ್ಟಿನಲ್ಲಿ ತಪಸ್ಯ ಫೌಂಡೇಶನ್ ಅಧ್ಯಕ್ಷರು ಮತ್ತು ಟ್ರಸ್ಟಿಗಳು ಎಲ್ಲರೂ, ದಾನಿಗಳು ಎಲ್ಲರೂ ಸೇರಿ ತುಂಬ ಕೆಲಸ ಮಾಡ್ತಾಯಿದ್ದಾರೆ. ಇವತ್ತು YENEPOYA ಈ ಆಯುರ್ವೇದಿಕ್ ಕಾಲೇಜಿನಲ್ಲಿ ಯೆನೆಪೋಯ ಯೂನಿವರ್ಸಿಟಿಯ ಮೂಲಕ ಯೆನೆಪೋಯ ಯೂನಿವರ್ಸಿಟಿಯ ಚಾನ್ಸಲರ್ ಆದಂಥ ವೈಸ್ ಚಾನ್ಸಲರ್ ಆದಂಥ ಡಾಕ್ಟರ್ ವಿಜಯಕುಮಾರ್ ಅವರು ನಮಗೆ ಪ್ರಾರಂಭದಿಂದಲೂ ಇವತ್ತಿನವರೆಗೂ ಬೆನ್ನಿಗೆ ಸಪೋರ್ಟ್ ಆಗಿ ನಿಂತು ಸಹಾಯ ಮಾಡಿದರು ಡಾಕ್ಟರ್ ವಿಜಯಕುಮಾರ್ ಅವರು ಅಂತ ಹೇಳಿದರೆ ತಪ್ಪಾಗಲಿಕ್ಕಿಲ್ಲ. ಇವತ್ತು ಅವರ ಒಂದು ಇನ್ಸ್ಟಿಟ್ಯೂಷನ್ನಲ್ಲಿ ಪ್ಯಾಲೇಟಿವ್ ಕೇರ್ ಸೆಂಟರ್ ಮುಡಿಪಿನಲ್ಲಿ ಪ್ರಾರಂಭ ಆಗೋ ಮುಂಚೆ ಇನಿಷಿಯಲ್ ಆಗಿ ಇಲ್ಲಿ ಪ್ರಾರಂಭ ಆಗಲಿ, ನಮಗೆ ಸಹ ತಪಸ್ಸಕ್ಕೆ ಮತ್ತು ಲಯನ್ಸ್ ಕ್ಲಬ್ಬಿನ ಸದಸ್ಯರಿಗೆ ಅದರ ಅನುಭವದ ಮೂಲಕ ಆ ಸೆಂಟರನ್ನು ಇನ್ನೂ ಉತ್ತಮವಾಗಿ ನಡೆಸಲಿಕ್ಕೆ ಮುಂದಿನ ದಿನಗಳಲ್ಲಿ ಸಹಾಯಕ ಆಗ್ಬೋದನ್ನೋ ಉದ್ದೇಶಕ್ಕಾಗಿ ಡಾಕ್ಟರ್ ವಿಜಯಕುಮಾರ್ ಅವರು ಈ ಆಯುರ್ವೇದಿಕ್ ಕಾಲೇಜಿನಲ್ಲಿ ಪ್ಯಾಲೇಟಿವ್ ಕೇರ್ ಸೆಂಟರ್ಗೆ ಒಂದು ವಾರ್ಡನ್ನು ಕೊಟ್ಟಿದ್ದಾರೆ. ನಮ್ಮ ಕೆಲಸ ಇವತ್ತು ಪ್ರಾರಂಭ ಆಗಿದೆ ಅಂತ ನಾನು ಹೇಳಲಿಕ್ಕೆ ಬಯಸ್ತೇನೆ. ನಮ್ಮದಂತಂದರೆ ತಪಸ್ಯ ಮತ್ತು ಲಯನ್ಸ್ ಕ್ಲಬ್ ಇಂಟರ್ನ್ಯಾಷನಲ್ ಸದಸ್ಯರ ಕೆಲಸ ಈ ಪ್ಯಾಲೇಟಿವ್ ಕೇರ್ ಸೆಂಟರ್ನಲ್ಲಿ ಪ್ರಾರಂಭ ಆಗಿದೆ ಅಂತ ಹೇಳಲಿಕ್ಕೆ ಬಯಸ್ತೇನೆ. ಈ ಮೂಲಕ ಬರೀ ನಾವು ಈ ಪ್ಯಾಲೇಟಿವ್ ವಾರ್ಡಿನಲ್ಲೆಲ್ಲ ಇನ್ನೊಂದು ಕೆಲಸ ತಪಸ್ಯದ ಮೂಲಕ ನಡೀತಾ ಇದೆ. ಮನೆ ಮನೆಗೆ ಕ್ಯಾನ್ಸರ್ ಪೇಷಂಟ್ ಇರುವವರ ಮನೆಗೆ ಭೇಟಿ ನೀಡಿ ಅವರಿಗೆ ಅಗತ್ಯ ಇರುವಂಥ ಆರೈಕೆ ಮತ್ತು ಸೇವೆ ಎರಡನ್ನು ತಲುಪಿಸುವಂಥ ಕೆಲಸ ಮೊಬೈಲ್ ವ್ಯಾನ್ನ ಮೂಲಕ ನಡೀತಾ ಇದೆ. ದಕ್ಷಿಣ ಕನ್ನಡ ಸುತ್ತದ ಎಲ್ಲ ಅಂಥ ಅಗತ್ಯ ಇರುವ ಪೇಷಂಟ್ಗಳಿಗೆ ನಮ್ಮ ತಪಸ್ಯದ ಮೂಲಕ ಈ ಕೆಲಸ ನಡೀತಾ ಇದೆ. ಅದನ್ನು ಸಹ ಇನ್ನೂ ಎತ್ತರಕ್ಕೆ ಏರಿಸುವಂಥ ಪ್ರಯತ್ನಗಳು ಟ್ರಸ್ಟಿಗಳ ಮೂಲಕ ನಡೀತಾ ಇದೆ. ನಮ್ಮ ಕೊನೆಯ ಆಶಯ ಏನಂತ ಹೇಳಿದರೆ ಆದಷ್ಟು ಬೇಗ 4 ಅಂತಸ್ತಿನ ಈ ಉಡುಪಿನ ಪ್ಯಾಲೇಟಿವ್ ಕೇರ್ ಸೆಂಟರ್ ಸಮಾಜಕ್ಕೆ ಅರ್ಪಣೆ ಆಗಬೇಕು. ಆ ನಿಟ್ಟಿನಲ್ಲಿ ಅವರು ಹಲವಾರು ಪ್ರಯತ್ನಗಳು ಮಾಡ್ತಾರೆ. ಇದರಲ್ಲಿ ಬರೀ ಸೆಂಟರ್ ನಡೆಸೋದು ಅಷ್ಟು ಸುಲಭದ ಕೆಲಸ ಅಲ್ಲ. ಅದಕ್ಕೆ ಬಿಲ್ಡಿಂಗನ್ನು ಕಟ್ಬೋದು, ಆದರೆ ಸೆಂಟರನ್ನು ಪ್ರತಿ ವರ್ಷ ಅದಕ್ಕೆ ಬೇಕಾದ ಸಂಪನ್ಮೂಲ ಮತ್ತು ಸ್ಟಾಫು ಇದನ್ನೆಲ್ಲ ಮೇಂಟೈನ್ ಮಾಡೋದು ಅಷ್ಟು ದೊಡ್ಡ ಸಣ್ಣ ವಿಷಯ ಅಲ್ಲ. ಆ ನಿಟ್ಟಿನಲ್ಲಿ ಟ್ರಸ್ಟಿಗಳು ಕಟಿಬದ್ಧರಾಗಿ ಕೆಲಸ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. ಫಂಡ್ ರೈಸ್ ಮಾಡಲಿಕ್ಕೆ ಪ್ರಯತ್ನ ಮಾಡ್ತಾ ಇದ್ದಾರೆ, ಕಟ್ಟಡ ಕಟ್ತಾ ಇದ್ದಾರೆ. ಅದಕ್ಕೆ ಬೇಕಾದ ಬೇರೆಲ್ಲ ವ್ಯವಸ್ಥೆಗಳನ್ನು ಮಾಡುವ ನಿಟ್ಟಿನಲ್ಲಿ ಸಹ ಪ್ರಯತ್ನಗಳು ನಡೀತಾ ಇದೆ. ಬಾಂಬೆಯಿಂದ NP ಶೆಟ್ಟಿಯವರಂಥ ದಾನಿಗಳು ಈ ಸಂಸ್ಥೆಗೆ ಸಹಾಯ ಆಗಿದ್ದಾರೆ. ಇನ್ನು ಹಲವಾರು ದಾನಿಗಳು ಬೇರೆ ಬೇರೆ ಬೆಂಗಳೂರು, ಬಾಂಬೆ ಈ ಥರದ ಬೇರೆ ಬೇರೆ ಕಡೆಯಿಂದ ದಾನಿಗಳು ನಮ್ಮೊಂದಿಗೆ ಸೇರಿಕೊಂಡಿದ್ದಾರೆ. ಇದು ಕೊನೆಯಲ್ಲಿ ಇದರಲ್ಲಿ ಇದು ಬರೀ ಸೇವೆ ಮಾತ್ರ, ಇದರಿಂದ ಯಾವುದೇ ಫಲಾಪೇಕ್ಷೆ ಇಲ್ಲದೆ ಮಾಡುವಂಥ ಸೇವೆ. ಒಂದು ಅಂತಃಕರಣ ಇದ್ದವರಿಗೆ ಮಾತ್ರ ಇಂಥ ಒಂದು ಕಟ್ಟಿಬದ್ಧವಾದ ಸೇವೆ ಮಾಡಲಿಕ್ಕೆ ಸಾಧ್ಯ. ಆ ನಿಟ್ಟಿನಲ್ಲಿ ತಪಸ್ಯದ ಚೇರ್ಮನ್, ಟ್ರಸ್ಟಿ ಹಾಗೆ ಲಯನ್ಸಿನ ಕೆಲವು ಬಂಧುಗಳು ಎಲ್ಲರೂ ಸೇರಿ ಇದರಲ್ಲಿ ನಿರಂತರವಾಗಿ ಕೆಲಸ ಮಾಡ್ತಿದ್ದಾರೆ. ಅವ್ರಿಗೆಲ್ರಿಗೂ ನಾನು ಈ ಸಂದರ್ಭದಲ್ಲಿ ಒಂದು ಆ ಕನಸಿನ ಒಂದು ಹಂತಕ್ಕೆ ನಾವು ಇವತ್ತು ಬಂದಿದ್ದೇವೆ, ಒಂದು ಪ್ರಾರಂಭದ ಹಂತಕ್ಕೆ ನಾವು ಬಂದಿದ್ದೇವೆ. ಆ ನಿಟ್ಟಿನಲ್ಲಿ ಈ ಪ್ಯಾಲೇಟಿವ್ ಕೇರ್ ಸೆಂಟರ್ ಯೋಜನೆ ಮೂಲಕ ತಪಸ್ಯದ ಮುಂದಿನ ಯೋಜನೆಗಳು ಯಶಸ್ವಿಯಾಗಬೇಕು ಈ ಸಂದರ್ಭದಲ್ಲಿ ನಾನು ಹಾರೈಸ್ತೇನೆ. ನಾನು ವಸಂತ್ ಕುಮಾರ್ ಶೆಟ್ಟಿ, ಲಯನ್ಸಿನ ಹಿಂದಿನ ಡಿಸ್ಟ್ರಿಕ್ಟ್ ಗವರ್ನರ್. ಈ ಫಂಡ್ ತರಲಿಕ್ಕೆ ವರ್ಷದ ಅವಧಿಯಲ್ಲಿ ಪ್ರಯತ್ನ ಆಗ್ತದೆ. ಇನ್ನು ಮುಂದೆ ಸಹ ಫಂಡ್ ತರಲಿಕ್ಕೆ, ಇದು ಒಮ್ಮೆ ಸೆಂಟರ್ ಪ್ರಾರಂಭ ಆದರೆ ನಮಗೆ ಫಂಡ್ ತರಲಿಕ್ಕೆ ದೊಡ್ಡ ಸಮಸ್ಯೆ ಏನಾಗೋದಿಲ್ಲ. ಆದರೆ ರನ್ನಿಂಗ್ ಕಾಸ್ಟ್ ಮಾತ್ರ ತಪಸ್ಯದವರು ಮಾಡಬೇಕು. ದಿನನಿತ್ಯದ ಏನು ಖರ್ಚಿದೆ ಅದನ್ನು ಅವರೇ ಮಾಡಬೇಕಾಗ್ತದೆ. ಹಾಗಾಗಿ ಫಂಡಿನ ಅಗತ್ಯ, ದಾನಿಗಳ ಅಗತ್ಯ ತುಂಬ ಇದೆ. ಆ ನಿಟ್ಟಿನಲ್ಲಿ ಪ್ರಯತ್ನಗಳು ಸಹ ಆಗ್ತಾ ಇದೆ. ಧನ್ಯವಾದ.
ಇಲ್ಲಿ ಬೇಗ ಆದರೆ ಪ್ಯಾಲೇಟಿವ್ ಕೇರ್ ಸ್ಟಾರ್ಟ್ ಮಾಡಿದ್ರೆ ಅಷ್ಟು ಡೈರೆಕ್ಟ್ ಶಿಫ್ಟ್ ಆದರೆ ಮಾತ್ರ ಉಪಯೋಗ and Bombay
the donor, supporter and well-wisher.